Well, good afternoon, everyone. We're so excited to have you joining us for today's webinar, Vacunas en el Campo, COVID-19 Vaccination Essentials for California Farm Labor Contractors. Today's webinar is a collaboration between AgSafe and the California Department of Public Health, made possible by Together Towards Health, a program of the Public Health Institute. For those of you I have not had the pleasure of meeting, my name is Teresa Keene and I'm President and CEO of AgSafe. I thought I'd tell you a little bit about how this webinar came to fruition and then hand it over to Tomas over at CDPH to get us started. So this webinar came about as we were having discussions with CDPH about the desire to reach our agricultural industry and in particular, our vital farm labor contractors and regards to COVID-19 vaccinations. Since we all know a few farm labor contractors, we decided it was a good idea to put this webinar specifically for all of you. Today's webinar is going to be in English, and then tomorrow we'll be offering the same webinar with some different people in Spanish. So if you know of someone that you think should be listening in and getting this information, please feel free to pass along the details of the webinar and ask them to register or pass them the link so they can log in tomorrow at noon and listen to this presentation in Spanish. Today's presentation is going to be recorded and all of the information that we're providing today will be sent to all of you along with resources. If you have a question today, we'll be using the chat function. So feel free to write your questions in the chat function and then we will be providing them to the speakers as we end each segment. And then if there's time at the end, we'll be bringing all the panelists back and we can ask some discussions and have a good discussion. And additionally, I will be asking a few questions as well to get your perspective on how best we can continue to support you in your efforts to prevent COVID-19 for your workforce and also provide vaccinations. With that, I'm going to hand over the presentation to Tomas Evangelis. I can't, oh, good heavens, I'm having a hard time. It's a Monday, please forgive me. He is my co-host for today and outreach officer for CDPH Vaccine Task Force. So Tomas, thank you so very much.
Thank you so much, Teresa. And no worries about the last name, it's Evangelista.
Yes,
and
it too.
No problem. And welcome everybody who is in attendance and thank you for joining us today. I know all of you are very busy with this harvest season, but we really appreciate you taking the time to join us and learn a bit more on the vaccination efforts and how you as farm labor contractors can help get your employees vaccinated. Like Teresa mentioned, we've had several conversations with stakeholders and farm workers and ranchers and other parts of the ag community, and one of the best ways they thought that would be to reach the farm workers, the people that are out there doing the hard work, you know, putting food on everybody's tables and it's an important group to focus on these efforts, and the best way they thought would be with farm labor contractors. So we decided to put this on, and as Teresa mentioned, tomorrow this will be all in Spanish, and we welcome and all so please share this link so that people that need that Spanish language are able to get this information. But we wanted to first go over a few of the things that we're going to be sharing today. One of them are the COVID-19 updates that we're going to go over with some important information. And then, of course, the resources that Teresa and I will be sharing are very crucial to provide, and those will be sent out also in an email or a follow-up email later today or tomorrow. So also we wanted to end with with an employer testimonial experience, so that, some of you, I know that in these efforts, it's a unique perspective with the ag community that that could be provided. So we have a presenter there as well. So I wanted to share just quickly on this agenda prior to us getting started. So and just a reminder, you can ask a question via the chat. After our first presenter, we will be looking at some of those questions, but I know that sometimes another question might come up later on. So at the end, we will also be revisiting that chat function so that we can make sure that we're answering everyone's questions on here. But once again, thank you so much for joining us for this presentation. And with that, I want to present an important individual for our presentation. I know there's so many questions still regarding the COVID-19 vaccines, the safety, efficacy, some questions regarding boosters and other things that we are so thankful to have Dr. Tom Boo from the CDPH immunization branch here to go over a presentation and answer some of your questions. So with that, I'd like to present Dr. Tom Boo for this section, and thank you so much.
Hey, thank you, Tomas. This is Tom Boo. It's my pleasure to speak with you all today. Thanks for joining us. Next slide, please. Next slide. Yes. So again, my role is to provide a brief update on vaccines, as Tomas said, including our progress statewide. Next slide, please. Okay, so I do want to just start by emphasizing that the COVID-19 vaccines are remarkably effective and safe. I'm extremely impressed with the products that we have to fight the pandemic. As many of you know, there are 3 currently authorized vaccines. The Pfizer-BioNTech vaccine is the only one that's fully FDA approved, and it's also the only one that is authorized for use down to age 12. It's a 2-dose vaccine with the doses spaced apart by 3 weeks. Moderna is the other similar mRNA vaccine. It's currently only authorized for 18 and older, although I believe the FDA will be considering expanding the authorization for younger kids in just a few weeks. And Moderna is given 28 days apart, 4 weeks apart. And then our third vaccine is the Johnson & Johnson or Janssen vaccine. And that's also only authorized for 18 years or older. And it's currently single dose, although there is some regulatory review of possible second dose ongoing. So like all things COVID and pandemic, everything changes. Next slide, please. So in addition to being extremely effective and safe, as I mentioned, the vaccines are also free. They're purchased by the federal government. Cost should not be a barrier. And the vaccines are very effective at preventing an infection after the initial months of vaccination. But even as months go by, they remain extremely effective at preventing severe disease, hospitalizations, and death. And the vaccines have maintained their effectiveness even against the Delta and other variants that have challenged us recently. And as we continue to experience new strains, new variants of the vaccine, the best way to deal with it is to get vaccinated. And we're doing fairly well in California, but a lot of variability from place to place. About 70% of Californians are fully vaccinated, but we want everyone to get vaccinated and to be protected. And thank you for helping us achieve that goal with the people that you work with. Next slide, please. So some recent changes. Back in August, the FDA authorized the use of both Pfizer and Moderna for people with weak immune systems. And it's like a booster dose, but it's different than a booster dose because they feel that a booster means someone who had a good immune response to the initial doses, but after time has passed, need a third dose to maintain that immunity, whereas they consider an additional dose the appropriate term for somebody who may not have responded normally to the initial vaccination. That's a fine technical point, but it's a third dose, and so the first people who were approved for third doses was people who are undergoing treatment for cancer, people who've had transplant, and people with with advanced HIV. And then probably the largest group, there are a lot of medications that people take for different conditions that can suppress your immune system. And all those people, we're trying to encourage them to get a third dose as soon as they can. Next slide, please. So more recently, just about a week ago, the FDA and the CDC and the Western States Scientific Safety Review, everyone has signed off on and approved booster doses for people who are considered to be at higher risk for more severe disease if they do have an infection after being fully vaccinated. And so big focus on people in nursing homes, on people who are over 65, and then also want to be sure to encompass people who are less than 65, but over 50 who have underlying medical conditions, and it's quite a long list of medical conditions with common things, including diabetes and obesity being considered risk factors. So quite a lot of people in California actually qualify now for boosters. So we also are recommending vaccination to people who are socially vulnerable in the lower indices of socioeconomic and residence status, and that would include a lot of the farm worker community for sure. So all these people are eligible for boosters. We're saying that people over 65, people in care facilities, people 50 to 64 with underlying conditions, and people with racial or ethnic minority status that puts them at risk should get boosters, whereas there are other people, including healthcare workers like me, teachers, people in other occupational settings, and people who are younger, between 18 and 50, who have underlying health conditions, who can get it. So the older people, it's a should recommendation, and in younger people and in people with occupational risk factors, it's a can get it. Next slide, please. So this is just a note on the concept of booster doses in general. It's normal for many vaccines require 3 or even 4 doses. If we think back to the vaccines that we give our children, there'll be 3 doses the first year, and then a booster dose when they're 5, and then sometimes a booster dose when they're somewhat older. And it depends on the vaccine, but it appears that for really long-lasting immunity, many people may require 3 doses of the Pfizer vaccine. And again, this only applies to the Pfizer vaccine right now. The FDA will be considering boosters for Moderna and the Johnson vaccine in the next 2 weeks. So it may be authorized and approved for other vaccines very soon. But for right now, it's only people who received Pfizer at least 6 months ago and are in one of those groups that I just talked about in the previous slide, who would qualify for a booster. And I'd like to just emphasize that the vaccines, that people who are vaccinated do sometimes occasionally get severe disease and are hospitalized and sometimes even less commonly die. But the vaccines continue to be very, very effective at protecting against severe disease, hospitalization, and death. We just see more people getting infections after vaccination, after time has gone by. And partly that's a result of the time that's gone by since vaccination, but it's probably partly a result of the increased infectiousness of the Delta variant. Next slide, please. So just a note on our progress in California. I touched on this already, but California has now administered over 49 million doses of vaccine to people, and that gives us a tally of 70% of people in California. I believe the numbers as of yesterday were 70.6% of people are fully vaccinated, meaning they've received 2 doses of one of the mRNA vaccines or 1 dose of the Johnson & Johnson vaccine, and another 8% are partially vaccinated, meaning they've gotten at least 1 dose of one of the mRNA vaccines, Moderna or Pfizer. So that puts us close to 80% of Californians with some degree of vaccination and protection against COVID. Cases are decreasing right now, which is fortunate after the challenges we've experienced, the hardships of the recent Delta surge. We're still averaging over 6,000 cases per day, and over 100 Californians continue to die every day from COVID-19. Next slide, please. So again, everyone in California from age 12 and up is eligible to receive a COVID-19 vaccine, and not just eligible, but it's highly recommended. And it should be fairly easy to find a place to get vaccinated. One of the best ways to do that is to go to the website myturn.ca.gov, and you can see what places offering vaccination are available in your area. They ask you to put in your town or your zip code, and then you can make an appointment. And there's also many places where appointments aren't necessary, and walk-in vaccination is possible. There's also a toll-free number for people who don't have access to or don't want to use the computer, and that number is provided here. And then there are a lot of other ways that people can get vaccinated. Actually, most of the vaccines being given in California right now are being given at pharmacies. Many doctors' offices and clinics are now offering COVID vaccination. And as you may know, there are a lot of efforts to, different large employers, schools, others are trying to offer, temporary, what we call pop-up clinics, where people can get vaccinated at a convenient location where they go to school or work. Next slide, please. So this slide just illustrates, what I've already spoken of, just how effective these vaccines are. And so, in these 2 little graphs, the blue lines, the lower lines at the bottom, are for people who are vaccinated, and the red lines are for unvaccinated people. And the slide on the left shows deaths, and hospitalizations looks very similar. But for this very recent data, from about a month ago, people who are vaccinated were more than 17.5 times less likely to die from COVID than people who are unvaccinated. And unvaccinated people who have not been vaccinated are more than 8 times more likely to get infected with COVID. So the vaccines are not 100%, they're not perfect, but they're extremely effective. They're one of the most effective vaccines that we have. I'm very, very impressed with them. Next slide, please. And just a word on the Delta variant, which has been, the Delta variant is now the predominant form of the coronavirus in this country, as it is in much of the world. Almost all the cases we're seeing in California now are from the Delta variant. And the Delta variant has become so common because it's so infectious. It's so good at spreading from person to person, or one person can infect many people. And when we see a new variant, we're always, very concerned to find out whether the vaccines that we have and the medications that we have for treating COVID work against the new version, the new variant. And we continue to see excellent protection with the current vaccines against the Delta variant. So that's been a big relief for us. Very, very, very reassuring finding. And we still have to be particularly careful. The vaccines don't mean that we have no risk of becoming infected or infecting others. So it's important to take those other measures to stay away from other people if you might be sick. Wear a mask if you're in an indoor setting, especially one with uncertain or not very good ventilation. All those good things that we've been talking about throughout this terrible pandemic. Next slide, please. So wanted to touch on a couple of issues around reproductive health and COVID and COVID vaccines. We are increasingly confident with these new vaccines that they are safe in pregnancy and in breastfeeding. And we worry about pregnant women because women who are pregnant and get COVID have much higher risk of becoming severely ill and even dying. And there are also, the infection can also cause some pregnancy complications. So we, the state, the federal government, CDC, the American College of Obstetricians and Gynecologists, everyone's now really recommending strongly that pregnant and breastfeeding women get vaccinated. And we're not doing that well. As a nation. I think, as of a month or so ago, only about 30% of women who happen to be pregnant were vaccinated. And we really want those women to consider vaccination as soon as possible to protect themselves and of course, their unborn child. Additionally, there's been misinformation, stuff that is just frankly untrue about COVID-19 vaccines affecting fertility in both women and men. And there's absolutely no evidence. There's no truth to it. It's just misinformation by mischief makers and innocent people spreading things that really have no scientific basis. There's no truth to it. COVID-19 vaccines, there's no evidence they cause any fertility programs in anybody. Next slide, please. Yeah, so this slide just again tries to illustrate what's going on from a regulatory and availability point of view for different age groups with the different vaccines. And so Pfizer is now fully FDA approved for people 16 years and up, and it is authorized under the emergency use authorization for children 12 and up. We think that within the next month or so, it might be available to children 5 and up. The FDA has just announced that a meeting's been scheduled to review the data and to make a recommendation for the 26th of this month. So this may be available to children 5 and up very soon. Moderna and Johnson & Johnson are currently only available for people 18 and up under the emergency use authorization. We have lots of experience, lots of data now about the effectiveness and safety. And so FDA full approval is expected soon. And again, there are some FDA meetings about these two vaccines scheduled, committee meetings open to the public, viewable online, coming up in the next couple of weeks. Next slide, please. And I'll be happy to take any questions through the chat now or later, but I appreciate the chance to share some information with you.
Thank you so much, Dr. Boo, for your presentation. A lot of helpful information there. I learned something new every time I listen to doctors share a bit. I do have a question myself, just something that I've been hearing with some conversations that I've had with some farm worker stakeholders, and what we've been hearing from our community-based organizations is that in regards to a booster, some, of course, of the farm worker community received the Johnson & Johnson vaccine, and I actually received the Johnson & Johnson vaccine, or Janssen, myself. And there's a little bit of some concern with, them asking about boosters, and I think even some have tried getting like an mRNA vaccine, like the Pfizer and Moderna. So a little bit of mixing there, and I'm not sure, where this information or where they got this information, but just wanted to just ask you if that's something that should be done, or if that's, I don't think it's safe, but I think it might be a question that some on here might have regarding mixing vaccines as like a booster. So I just wanted to see if you can share a little bit on that.
Yeah, thanks, Tomas. Extremely common question. A lot of people very interested in this issue, including me. And there are a lot of studies going on, like the United Kingdom and some other countries are doing a notable amount of work on sort of mixing and matching vaccines. And we haven't seen a lot of that data yet, and it's currently not authorized or approved by the FDA and CDC to mix vaccines. I know people are doing it, but I will say that, I mentioned these important upcoming meetings of the FDA, and they will be talking about the evidence and the safety and the effectiveness of mixing vaccines, along with the question of second doses for Johnson & Johnson recipients. J&J actually, in a press release, I think just last week, they shared with the world some of their data on giving a second dose, and it looks very good. So single dose J&J provides solid protection against severe disease and death, but it's always been somewhat lower than the mRNA vaccines. But the data they shared in their press release, and again, we haven't seen the actual scientific level data to for people to really review it in detail. It looks like with 2 doses, Johnson & Johnson is, has a vaccine effectiveness that's up there with Moderna and Pfizer, but it's just not authorized just yet. But changes are coming very soon, I think.
Thank you so much for that clarification. And so I think a lot of people should caution and advise to wait for the data and the approval. But thank you so much. I think that's the question that some of us have had. But really appreciate, Dr. Boo, your insights and information. And for anybody out there that has a question, please enter it in the chat. It could be a simple question, doesn't have to be anything complex. All these questions are very important for us.
Tomas, I actually have another question for Dr. Boo. So Dr. Boo, you talked a little bit about the Delta variant, and it feels a little bit like we're on a roller coaster right now. So we're coming down from the Delta variant, and the caseload is starting to lighten. What do you guys see, what's on the next horizon? What other variants are starting to come to fruition? If you have any information on that, I know our audience would be really interested to hear more.
Yeah, thanks, Teresa. There are some other variants out there that the world and we and CDC are watching, but nothing so far that seems to be taking off the way first the Alpha UK variant and now Delta have, but there's so much coronavirus circulating in the world, in unvaccinated parts of the world, that the risk is always there that the next new improved Delta will rise somewhere, anywhere, and spread rapidly. So nothing right now to really call to your attention, but we all need to continue to monitor the situation very carefully.
Yeah, thank you for that. Appreciate it. Any other questions for the doctor, since we've got him? Everybody's quiet today. It's Monday. Okay. All right. Well, and Dr. Boo is going to continue to hang on, and we are going to continue with our presentation. So, Tomas, I'm going to hand it over to you so you can talk about resources CDPH has available.
Yes, thank you so much, Dr. Boo, again for your presentation. And we're going to move forward with to share some of the resources available. I do see a question in the chat, and thank you so much for asking this question. So I'll be taking care of it. Any updates on upcoming testing protocols due to the 100+ employee companies who pay for what kind of tests are available? At the moment on this, I do not have an update. I have to apologize just because on the testing availability, I haven't been able to get any resources, but we will be following up with resources and also this important question. So if you did sign up for this presentation, I think, Teresa, we will be having a follow-up email, and I'll be hopefully able to answer that question. Just need a little bit more time. So again, my apologies for that. But I want to see if we can move forward with some of the vaccination resources. Like I mentioned earlier, my name is, I'm the outreach officer for the COVID-19 vaccine task force. So we do have more vaccination related resources, and I'm gonna share my screen. Teresa, do you think I can share my screen real quickly? Let's see.
Hold on.
Give me one more. Oh, here it is. Okay. I just want to share about a few of the resources that we have regarding vaccinations. I know that a lot of you work with some employees, some farm worker contractors. So we want to share like a few, and I'm going to link the access to this document that could be designed and printed to provide to some of your employees. One of them is just creating my COVID-19 action plan that could provide some of the information that's needed. One important thing that I think the doctor mentioned is my turn and the phone number that could be accessed so that they can find a COVID-19 vaccine site, and also just providing some of this information that could be adjusted to provide different information, and even adding another logo on here. So that's one area that that could be shared. I think another one, which, give me one moment. Whoops, let me pause there real quickly so I can switch over to the next one. Having a hard time with some of this. Can you see my screen, Teresa?
I can.
Yeah, and another resource, of course, is some information in a flyer form that some of you can provide to your employees, where this is also available in Spanish as well, that, you know, is pretty simple to share, and just so that they could continue to get that information on where they can find a vaccination appointment. There, I know there's a lot of areas where people can get vaccinated outside of the workplace. And we just want to make sure that some of you are able to provide this to the employees so that they can know where to go outside of work and some of those. So let me see where the next one is. Let's see. Give me one moment. So I wanted to share also a bit of our ambassador program, just because it is something that we're launching, and some of you on here, of course, are trusted messengers in the community, or are able to share some of the important information to either your employees or community or family members. And we want to make sure that you have this this information and this program, with the purpose is, of course, to equip everybody with the tools and messages needed to champion the Vaccinate All 58 campaign. And we want to create more people that become active voceros and voceros, or spokespersons or ambassadors for the COVID-19 vaccination campaign. And some of these conversations, you know, that people are having are, you know, with their employer or with somebody, a friend or a family member, are more effective. So wanted to make sure to provide some of this information. And what our ambassador program is are some videos that provide some information of vaccines, the vaccines that are effective, safe, and free, and then also some other information about some research and how they can get vaccinated, as well as vaccinations for youth. So this program, you know, just provides some important information and just 5 easy to use videos, and they're going to be available in 10 languages, and they contain just short messages addressing frequently asked questions about vaccines and toolkits, and just really just some key messages here that we want to make sure that people are able to share on. And let me see. I will provide a link on here for this program so that people are able to sign up for it and make sure that they're able to access some of those videos that you can share with some employees and also with other individuals. So Teresa, that's it on my end. I know there's some great resources that your organization is providing as well, so I wanted to hand it over to you.
Great. Thanks, Tomas. So AgSafe, we have been working diligently behind the scenes the past, good heavens, since January on developing some really reliable resources for employers. So we have been working more on the end of educating your workforce about COVID-19 and how to help prevent the spread. So we really took the emergency temporary standard, drilled down what are the training components that you all need to make sure that you are continuing to message out to your workforce and put together those resources for you. So a few things that we've got available that are coming out now, which will be available on our new website, which we're debuting, I'm fingers crossed by Wednesday, and they'll be on our website, and I will also send them out to you via this link in the post webinar email. First of all, we've got some videos that we created. So we did, the essential elements of COVID-19 protection, and we have made them available. There are 3 videos. They are no longer than 5 minutes long, nice and short, so you can do them in a series. And those are available in 5 different languages. So we did English, Spanish, Hmong, Punjabi, and Mixteco. So those will be coming out. The second thing that we also did was develop, for those of you that are needing to do some tailgate trainings and out in the field and don't have access to technology or reliable technology, we did a flip chart for all of you as well. So we've taken that information from those videos and put them into a flip chart where you can, on one side it is pictures, and then on the other side we've created a script for your supervisors, so that way they can follow, they can read the script, make sure they're hitting on all the main points, also including some of your own company policies. Again, just trying to make it really easy for you to communicate what the COVID protections are, making sure that you're aligning with Cal OSHA's regulations, and just, making sure that you're keeping your workforce safe. So those will be available. Like I said, we're launching our website on Wednesdays, so it will all be out, but I will also send you all a special link. And then the third thing that we also did is put together a PowerPoint presentation. So if you're doing something in-house, we will have that available to you as well. And that one will only be in just English and Spanish. So lots of things that we've been working on here. In addition to our resources, we also have the Western Center for Agricultural Health and Safety, and all of the resources that they have created through a program, a contract with a labor workforce development agency. They've got a ton of resources. We're going to be doing a mailing out to all of you with the resources that they've got available. And so just the industry has really come together, and I think produced some really great training docs and just information. We're just trying to keep everybody informed and helping you to navigate COVID with your workforce. Okay. All right, so that is the end of my piece. And now I'm really excited. I'm going to share my screen again. Hold on one moment. And see if I can find my PowerPoint. Hold on, everyone. All right. Tomas, can you see my PowerPoint?
I can't.
Oh, great. Okay.
Let's see. Can you try it again?
Hold on one moment. My computer's being a little finicky today.
There we go.
There we go. Okay, there's Joe. Okay, great. Okay, let's do this. Current slide. There we go. Shoo. All right. Well, I wanted to now turn this over to Joe DeBosque with DeBosque Farms. Joe is a farmer on the west side of San Joaquin Valley. He is a phenomenal ag employer, farm labor contractor. He is a past president of the AgSafe Board of Directors and one of my favorite people of all time. And Joe is going to be sharing with you some of his what he has done as an operation in terms of encouraging vaccinations with his workforce, and just to tell you a little bit about his story and how things transpired with him. So Joe, I'm going to hand this over to you. And I hope we did not lose Joe. Hold on, everyone.
Hi, Teresa. Yeah, I don't see Joe on. He was on earlier. And hoping, I know that I've had some Wi-Fi issues myself earlier this morning, so I'm hoping he's not having any issues and that he's able to jump on.
Okay.
Um, oh, he raised his hand. I think he might be in, but not in the presentation
There we
anymore.
go. Okay, I see him. Okay. Yeah, he might have fallen off, and we're going to promote him right now. Hopefully there he is. Hi, Joe. Can you hear us?
I can hear you, Teresa. Can you hear me okay?
Great. Yes, I can. I'm so sorry about that. Technology.
That's okay. I don't have my video enabled, but I guess that's okay.
That is completely fine.
Okay. Well,
So we just introduced you. So if you don't mind just sharing a little bit about your efforts in terms of vaccinations and what you've done with your operation and with your workforce.
well, thank you, Teresa, and hello, everyone. Good afternoon. I'm Joe Delbosky. I'm on the west side of Fresno and Merced counties. My wife and I both became very proactive in protecting our workers when this outbreak of COVID began last year. We initially started training, additional hand washing facilities, face masks, and social distancing right off the bat from, I think it was even as early as middle March of last year, to try to protect our workers. This year, when we knew that vaccines were coming out, we wanted to get vaccines as early as possible for not only our employees, but all the employees we could do in our communities out here on the west side. So I called our county supervisor. He directed me to the County Department of Public Health. In Fresno County, they have an ag liaison that I worked with. And we proposed to them that we do a public-private partnership to get people, in this case, essential workers, vaccinated. And I think they were glad to hear this because they had no idea how to reach farm workers. They had opened a vaccination site in Fresno, and we proposed that wasn't going to work. And so we proposed that we do an on-site out here in the areas where our employees live and work, that it would be much easier for them here than to send them to Fresno. We also proposed to them that that we could help the county in reaching the farm workers. We would be better at reaching them, bringing them in, doing their paperwork. We did everything, including the logistics of how to get people into the site, get them vaccinated, and out of the site, which the county really didn't have to do anything except send the shots out and a health team to administer the shots. And that's what we did. So we had, because we were gearing up for doing as many as possible, I submitted for 800 vaccines from the county, which they approved. Actually, I asked for 850 and then it took 50 away from me, but we got 800. And so we were among the first ag sites to do vaccinations. We did it in Fireball at a cold storage facility. And we wanted to do everything to make it as easy and painless, no pun intended, to our employees. So we made it a drive-through, and the county approved of that. We brought people in, they rolled their windows down, gave them the shot, drove on out. They had their little waiting period in their car, and then they went on their way. Worked really well. The the first day, I think it only took 5 hours to do 400 people. The second day, I think we did it like in 4 hours. It really works so well. And other people got interested in what we did. So I had some collaboration with folks down in the Huron area to get them set up. And then we held another one up here in the next county over Merced County on the west side also, in the Los Banos area. And most of these workers were cannery workers, but they're essential workers also. So we did a few weeks later in Los Banos, we did 1,100 people. So I think it was a very important thing that we did, first of all, mass vaccinations right off the bat, get as many people as we could get in and get their shots in their arms as soon as possible. And I think we showed that this was a good model to do that with farm workers. Then after that, because we didn't catch everybody, we caught everybody that was basically living in the area at that time, but we knew that later in the summer, there would be others that would be migrating in from other areas, and some of those did not have their vaccinations yet. Some came from Arizona, some came from Mexico. So we did another smaller vaccination, sort of a catch up of those that didn't have any. And that one we did right on our farm. We did our own employees. We did about 40 or 50 of them and got their vaccinations. It was easy by then to work with the county and the health team that gave the shots. It went really well, and so we're very glad that we got as many people vaccinated as possible in as short a time and as easy as possible, making it easy for our employees. I think one of the things that that is important to know is that our employees have a good relationship with us. They trust us, whereas maybe going to the county, they may have been a little bit more reluctant about that. So I met with the public health department last week. We're already looking ahead at what can we do together as a private public partnership. They see that this is a good way to get maybe other services, or also prepare for maybe the next pandemic if that happens. So we are working on thinking out what can we prepare for in the future. One of those things is what I'm trying to work on next is the booster shot. Our group did the Moderna shot, so we're not sure when that's going to be available. Pfizer has already been approved for the booster. Moderna, not yet, but they're talking about maybe 2 or 3 weeks. So we're getting prepared for that, to be able to offer that to our employees. We're also looking at possibly offering our employees at the same time do flu shots. I think it's been stated that having your flu shot helps you to ward off infections. So we want to see about offering that. And then there's we're exploring all sorts of things in this discussion we had with the county's public health officers about other things that we can bring out to the farm, to our employees, things like, for instance, diabetes testing and that sort of thing. Try to make, I think the county has seen that they found an avenue to reach people through us. And I think this is something that can be done anywhere and with any employers. And if it's large, whether it's large or small, if they're small, they can group together and bring these services to our employees. And we're even exploring how do we, also do not just the employees but their families. This is all important. We need to reach out to everybody in these farm worker communities. They're all important. Their families are part of this. As everybody knows, we could protect the employee, but he could go home and his folks, his family could get infected. So we're looking at all sorts of possibilities here that I think the county has never thought about. But this is something that I found that employers out here have been very enthusiastic about getting things like this out to our communities. All of the farmers, growers, shippers, canners were all very enthusiastic about getting their employees vaccinated and protected. So I'm very excited to see this happen because I've been an advocate for our rural communities that sometimes they get left behind, or sometimes they don't get the resources out in these remote small towns. So we're happy to be able to work with the county and get some of these resources out here to our employees. And I think that probably includes most of you that are farm labor contractors or ag employers. So with that, I'll make myself available if there's any questions.
Oh, thank you, Joe. That was phenomenal. I actually have a question for you. So I imagine that you've started thinking about this. You mentioned families. So as soon as I think it's going to be Pfizer first is available for children, are you going to think about hosting something for children of your farm workers and your employees?
Yes, I think that we need to include them in anything that we can do for our farm workers. We have to include the whole family, and they're for the people at the county, it's not that easy to reach them, but we as employers we can, and we need to advocate for our small communities and get all the the families, children, and wives and everyone involved.
Yeah, absolutely. Some of the things it just stood out to me that you said is that, first of all, I think what made your model a success is that you were the trusted partner in this, and that your employees know who you are, and you are walking the talk. And I saw their pictures. You got the vaccine. You were one of the first ones to get it at your operation. You made it easy for them to navigate the system, and paperwork is still scary for a lot of our population, and so helping them through that, and then hosting it at a site that they're familiar with, and as a drive-through, which is when you talk about vaccines, I guess the most fun you can make it a drive-through. And so it was phenomenal to see all those cars in line and all your employees getting that vaccination. So what were some of the, how did you prep your workforce? How did you get them to say yes to a vaccine?
We didn't really try to talk to anyone, but we told them that we thought that the vaccine was valuable in protecting them, and we wanted to offer it and make it as easy as possible. there were obviously some people holding back. We still have a few on our staff that are holding back, and there's nothing we can do to force them to take their vaccine. But at least we have everybody else protected. But yeah, I think you're right, Teresa, that this was something that it was important that the trust that these people have in us, their employers, was key. It was something that possibly the county would not have had. So so that was, part of our model that we proposed to the county, and the county was very glad to work with us. They were very happy to do this, because they may not have ever reached so many people in so short a time on their own. But they are willing to work with us out on the on the farms and so forth. Now, with whatever we need, they want to have mobile services that can go out anywhere in the county, and I think this is good. This has really been a good positive improvement in the way the county is able to serve the outlying communities.
Absolutely. And so actually, I wanted to, I have a question for Tomas. Joe has talked a lot about working with the county, and that has been his partner. How can folks, our FLCs here, FLCs, you work in lots of different communities. How can they establish those kinds of relationships? Can they go through California Department of Public Health to help get those mobile vaccine units out at their operations?
Thank you so much, Teresa, and thank you, Joe, for sharing your experiences with this, and for being a big advocate and vaccinating your employees and their families. That's a good question, Teresa. I was going to chime in a bit. I know initially the state did provide some large vaccination sites, and then did some mobile vaccines early on in the vaccination efforts. At the moment, there are not many opportunities from the state's level to provide mobile vaccinations. I do know that if you do have an employee, more than 100 employees, that I think we can at the state figure, excuse me, provide vaccines. But I know with farm labor contractors, some of them having only like 15, 20 employees, that the county at the moment is the best way, I think. What we can do, though, in my efforts, we've been outreaching to farm labor contractors via email and phone, providing some information and doing a warm handoff to the counties, so that we are able to make that connection. I understand that some on here might not, be able to do that, but I think what would be a good strategy, Teresa, is if we provide some of that information to get in contact with the county for some that I think are eager and are able to make those phone calls to the county and get connected. I think what we'll do is have that follow up, but also I welcome anybody on here to please email me or give me a call, because we can also at the state can share, can provide a warm handoff, and I'm adding my email to the chat, and then also afterwards, I think you also have my contact information. So wanted to just also share a bit of that on here as well.
Great, thanks, Tomas. I appreciate it. And we have run across some other partners who have said they will come out for 10 to 15 employees if you have them. So if you have a desire to offer vaccines for your employees, also reach out to me. We've got connections across the state and would be happy to help you get connected. And again, just trying to make it as easy as we possibly can, because we know everything else has just been so cumbersome. And as you reach out to us, we want to make sure that we're taking care of you. So with that, I don't see any other questions. Again, I think everybody's been a little quiet today, but if you happen to think of other things, feel free to send either Tomas or myself an email. We'll get right back to you. We'll send out this recording of the webinar with all of our resources. And again, I just wanted to thank our panel today. So Dr. Boo had to head off, but for his valuable insight and medical knowledge, and then also Joe DeBosque with DeBosque Farms. Thank you for your leadership in the industry and helping us to create some great models. Tomas, it was great. Thank you again for connecting with us and being willing to host this webinar together.
Great, thank you so much, and thank you all for joining. And again, tomorrow we will also be providing this webinar in Spanish with a doctor that is able to speak Spanish as well. So please, if you have anybody that'd be interested, share, or if you would like to hear it again in Spanish, also you're welcome.
All right, with that, we are going to say goodbye to everyone. Hope everyone has a great rest of your day. Stay healthy and stay safe. Thanks again. Bye-bye.